The cannabis plant produces a dazzling array of chemicals that can interact with the human body. Let's start with a brief overview about one class of chemical compounds that the cannabis plant produces: cannabinoids. We're going to look at 7 of them. One of the most well-known cannabinoids is THC, tetrahydrocannabinol. First discovered in 1964 by Israeli scientists, it's probably the most studied cannabinoid. When we ingest cannabis, THC binds to CB1 receptors in our brain that are part of the human endocannabinoid system. When THC binds to our endocannabinoid receptors, it initiates a cascade of changes in our central nervous system. One of the most pronounced effects of THC is to produce the psychoactive high effect that people feel when they ingest cannabis. Aside from this euphoric feeling, THC is strongly responsible for pain relief by blocking nerve pain signals to the brain. THC also eases nausea and vomiting, which is especially helpful for cancer patients undergoing chemotherapy. THC has also been shown to be a neuroprotectant by acting as an antioxidant to prevent damage to neurons in the brain. THC has also been shown to be a highly effective treatment option for PTSD because of its ability to ease symptoms including agitation, depression, insomnia, flashbacks, and nightmares. Cannabidiol, or CBD for short, is a non-psychoactive component of cannabis. This chemical doesn't interact very strongly with the endocannabinoid receptors in our body, but works by indirect action, modulating the activity of other neurotransmitters. One of the most celebrated health benefits of CBD is its pain-relieving effects. It also has powerful anti-seizure effects, along with the ability to reduce muscle spasms and inflammation. Additional research is showing that it may have antibacterial and bone growth stimulating properties too. CBN, or cannabinol, is produced when THC is heated or exposed to oxygen. CBN generates powerful sedative effects. Like CBD, CBN is an anti-inflammatory as well. Studies have shown that CBN could contribute to stimulating bone tissue growth. Cannabigerol, also known as CBG, is not present in large quantities in most cannabis strains, but it has some notable effects. CBG is thought to be particularly effective in treating glaucoma because it reduces intraocular pressure. It's also being researched for its antibacterial effects and for its potent tumor-fighting actions. Cannabichromene, also known as CBC, is another non-psychoactive component of cannabis. It's being studied for some promising effects, such as its cancer-fighting properties. In addition, it has been shown to block pain and inflammation associated with osteoarthritis. THCV, or tetrahydrocannabivarin, is similar to THC but doesn't have the psychoactive effects because of a slightly different molecular structure. Research has shown it to be promising when it comes to appetite suppression, assisting with blood sugar regulation as well as curbing anxiety and promoting bone growth. Last on our introductory list of cannabinoids is CBDV, cannabidivarin. It is molecularly similar to CBD and has shown promise in providing symptom relief from seizures, Crohn's disease, and multiple sclerosis.